Last semester, Dr. McClure and I did not get a chance to show you the side bending technique for assessment and treatment of the thoracolumbar spine, specifically the thoracic spine. There's a specific technique, but we're going to show it this semester. But before we show that one, I want to do a quick review of the rule of the lower finger, because I had a bunch of questions, a group of people coming at me with questions. But I want to explain this and explain it very well so that you grasp this, okay? So, when we're talking about improving rotation, when we work on improving rotation, we are simultaneously also working on improving side bending at that segment. So you need to know how rotation can also improve side bending. So when we talk about the Fried's law, we know that non-functional movement, side bending and rotation occur in the opposite directions for non-functional movement. For functional movement, they occur in the same direction, right? So now that you must understand that when you rationale the technique for rotation, if you use it to improve side bending, you must specify what are you improving. This will improve functional side bending, or this will improve non-functional side bending. So let's give an example. So this is T5 on T6. Rule of the lower finger. My middle finger, I want to say this clearly without misverbalizing, my middle finger is on the left transverse process of T5. I'm going to move T5 on T6. So when we talk about spinal mobility, we talk about the superior segment moving on the inferior segment all the way down. My index finger is going to be on the right transverse process of T6. You got that?
Sir.
Follow me. So only thing I got to do now is place, these are my dummy fingers. So now I can just place the hypothenar eminences or eminence aspect of my right hand. So notice I'm on the right side, and when I apply my PA, this is what happens. So you see my PA, T5 rotates towards me. That's to the what?
Right.
To the right. Now, simultaneously, which way is T6 rotating?
To the left.
But we're referencing T5 on T6. We're referencing how T5 is moving on T6. So I'm improving rotation to the right. Rotation, orthokinematically, there's a anterior translation and a slight up glide, slightly upward movement. All right? On the left transverse process, or the left facet joint. You see? All right? Does that make sense?
Yes.
On the left side, you get an anterior translation and a slightly superior motion. Does that make sense?
Yes, sir.
Okay. Now, I'm talking about T5, on the right TP, you have a backward translation, all right, a posterior translation with a slightly inferior down glide. It's doing the opposite of what the contralateral transverse process is doing. Does that make sense?
Yes, sir.
Okay, now I'm assessing or either mobilizing and improving rotation right at T5 on T6. Now, at this segment, for non-functional movement, since I'm rotating to the right, it will be helping with non-functional thoracic side bending to the left. Non-functional. Non-functional side bending to the left, because what has to happen is some rotation to the right for non-functional movement. Non-functional movement is in the frontal plane. Does that make sense?
Yes.
Y'all remember your planes of motion?
Yes, sir.
So that's in the frontal plane. Now, for functional movement, it will be functional side bending with like a forward bending to tie your shoes. With that technique would help with improving functional side bending right. Does that make sense?
Yes.
Yes, sir. That makes sense.
Is that clear?
Yes.
All right. Now, that's why I say you can use this technique to help with improving non-functional side bending. You just got to know which way we're going based off of the Fryet's law. And it can also be for functional side bending. You have to specify. So when y'all come at me with a lot of questions, sometimes I will say it depends. You see, because your question had to be specific. You say, okay, Dr. Carter, can this improve side bending? Well, yeah, it depends. What are you talking about? Functional or non-functional side bending?
So when you're standing on this side and you're in this same position here and you just did like your rotation towards you, and if you did that same motion towards you, that is for functional side.
Yes. So you got to know what functional side bending entails. Functional side bending typically incorporates some type of diagonal movement to the right. It may incorporate some forward bending as well, but it's not a pure sagittal plane, frontal plane like this. So this is a pure frontal plane side bending. The frontal plane is typically how we assess patients, until we start getting into some functional movement. So when we assess the thoracolumbar spine, even the cervical spine, we tend to assess non-functional movement or non-functional motion. You see? So now you just had to verbalize it and understand orthokinematics. So go back to the first. I think I even got this on YouTube videos. I don't have these posted in this section, in this course, because everything builds on. These slides are posted in the intro course. These are the slides that are up in the intro course. And not only do I give the orthokinematics, I give you examples. Let me show you what I'm talking about. So you gotta go back to them. But this is also in the book, but I'm here to clarify some things. So look at this. So I give a clinical imperative to increase segmental rotation, right? So rotation is described from the superior vertebrae on the inferior vertebrae. So to increase rotation, we can use the rule of the lower finger. That's what I just reviewed. Then I gave an example. So this is an example. This is what I just demonstrated in a sense, similar to this example, okay? But now, you could take it even further if you want to be able to explain how you're using this to improve side bending. Because what you would then have to apply is this. Components of non-functional side bending and components of functional side bending, which is what I just explained. Did you just record that? Give it to Dominique or Acacia or Kira. They are over my YouTube videos and they will post it. That way you can constantly go back and listen to it. So say, please post this on Dr. Carter's YouTube. That way you can always have it to go back and listen to it. That way you don't have to keep asking me the same question over and over to use our time efficiently. You have it to go back to it. You see? All right? So that's good that a group of y'all would want to know that, because That's part of the flipped classroom. You gotta have questions for your professor. So moving forward, we're gonna do our Q&A directly after we do our knowledge checks, moving forward this semester for both classes. Q&A is the lecture or review. It's based off of your questions, you see? So it's a lecture, but it's basically question driven. It's not just me going through slides and just talking through slides. So with the flipped classroom, there is a lecture component, but the lecture component is driven by questions that you have. Does that make sense?
Yes, sir.
So that means you gotta read, and if you have questions, write down the questions, and we will address those every single class. We're not gonna deviate. We're gonna address those after our knowledge checks. All right? Any questions about that? Did that help y'all out?
Yes,
Clear up
sir.
some things? Good.